The human urinary system is the body's drainage system for removing wastes and extra water. Comprises of a pair of kidneys, a pair of ureters, the bladder, and the urethra that perform the basic functions of the body like filtering your blood, urine formation and blood pressure regulation. Infection of any part of the urinary system is known as urinary tract infection or UTI. Urinary tract infection is a very common and painful human illness. Are the second most common type of infection in the body. Main symptoms of UTIs. You may have a urinary tract infection. You notice pain or burning when you urinate. An urge to urinate, often pressure in your lower belly, urine that smells bad or looks cloudy or reddish. Pain in your back or side below the ribs, fever or chills, if the infection reaches the kidneys. Hematuria or blood in urine. Causes of UTIs. Urinary tract infection are primarily caused by bacteria, most commonly Escherichia coli, E. coli, which is normally found in the digestive system. Other bacteria are Proteus staphylococcus and Klebsiella. The bacteria can enter the bladder via the urinary tract through the urethra. After gaining the entry to the bladder, E. coli are able to attach the bladder wall and make a biofilm that resists the body immune response. Important risk factors of UTIs. People of any age or gender can get UTIs, but about 4 times as many women get UTIs as men. Because women have a shorter urethra, making it easier for bacteria to reach the bladder. Sexual intercourse can introduce bacteria into the urinary tract, especially in young female. Urinary tract instrumentation such as urinary catheterization. You are also at higher risk if you have diabetes. After menopause, the decline estrogen levels can change the urinary tract, making it more susceptible to infections. Using certain types of birth control, like spermicides, can increase the risk. Diagnosed urinary tract infection. The first you should do is urinalysis. This is the most common test to diagnose a UTI. A urine sample is analyzed for the presence of urinary nitrites, white blood cells, red blood cells, and bacteria in your urine. The sample is examined under a microscope and sometimes tested with dipsticks that change color in the presence of certain substances. Treatment of urinary tract infections. Certain lifestyle changes and home remedies prevent and treat urinary tract infections. First remedy is to drinking plenty of water. Staying hydrated is often recommended to help flush out bacteria from the urinary tract and going toward recovery. Water helps to dilute urine and promote regular urination and remove bacteria from the urinary tract. Number 2 is cranberry juice. Some studies suggest that compounds in cranberries may help prevent bacteria from adhering to the urinary tract walls. It's most well-known natural remedies for urinary tract infections. However, it's essential to choose pure, unsweetened cranberry juice. Next is blueberries. Blueberries contain antioxidants and compounds that might have anti-inflammatory properties, which could be beneficial to prevent growth of bacteria that cause UTIs. Drink juice of blueberry at your breakfast. It's a best way to prevent infection. Number 4 is vitamin C. Vitamin C provide an acidic environment in the urine, which may inhibit the growth of bacteria that cause infection and protect against urinary tract infections. Foods rich in vitamin C, such as citrus fruits, strawberries, and bell peppers, might be beneficial. Next is to take a probiotics. It may help to maintain a healthy balance of bacteria in your gut and urinary tract. This can potentially support overall immune health. Probiotics, found in yogurt and supplements, improves your digestive health and immune function. Treatment general varies from person to person. However, Patients at risk of complicated urinary tract infections are best managed with broad-spectrum antibiotics include trimethoprim/sulfamethoxazole, nitrofurantoin, cephalexin, and fosfomycin for uncomplicated UTIs. That's all for today. If you found helpful, if so, like and subscribe to my YouTube channel. For more content, stay healthy and stay happy.